Oh, okay, good. Okay, I've been on this.
Okay, so that's fine. Yeah. My whole year is here. Oh, perfect. I know where. No, that's perfect. I just wanted to make sure. Last time when I was there, I never seen it. I asked her to sit Jim better because, for some reason, looking to the right is not hard. It's just, I don't know. It's just, I always think I'm left. Maybe it's because I'm looking for every year. I'm really sure. Yeah. You can.
Yeah, or the page that is.
What year? But I never know. That's what I never know. I never know. Kind of this night.
A lot of fun stuff. On my desk.
One second. Yeah, I'm fine. Two sides.
You are. Yeah.
So well. Prize, what? Okay, Caroline, I want Oh, okay. Yeah, yeah, well, like, you know, it's like then I can find Yeah. Would everyone please take your seat? We need to start. Thank you. Good afternoon. I'd like to call to order the Behavioral Health Advisory Board General Meeting for October 16th, 2023. Yes. Sorry, what? Oh, yes, I'm just sorry. We are waiting for our other interpreter. Our other interpreter to return, so we'll begin in just a minute. Thank you. We're still waiting for another minute for our interpreter to arrive at the meeting. Thank you.
For those of you who just joined us, we are waiting for our interpreter to arrive. She's been here, but she had to step out for a moment, so we will just be another moment. Thank you. Okay. I would like to call the meeting to order for the Behavioral Health Advisory Board General Meeting on October 16th, 2023. And I would like to have Jennifer Morrison do the roll to see if we have a quorum. And please, BHAB members, when your name is called, please state your district and also the committee on which you serve. Thank you.
Good afternoon, Claudia Arman. Soledad Verdon.
I'm here, Soledad Barragán, member at large and represent the Distrito 5.
Nancy Borchard.
Nancy Borchard, District 3, Cervantes. Adult company. That's not this happening.
Dave Brookings is not present. Kevin Parisi is not present. James Espinoza.
President District 4, and I'm a veteran representative. I'm not on our committee. Still shopping, so
Genevieve Flores Haro.
Present, District 1, District Disparities Committee.
Cheryl Heitman.
Cheryl let us know that she's going to be late, but she will be here. Thank you.
CJ Huey.
Present, District 2, Maintain Committee.
Supervisor Matt Levere.
Present and representing the board of supervisors.
Nomi Maruko.
Here, District 3, I'm also working with Spirit of Sample.
Diane McKay.
Here, Area 2 and Children and Adult Service.
Myself, Jennifer Morrison, District 4, and I serve on the Adult Services Committee. Sean Pusey is not present today. Dahlia Robkin.
Here, District 4 and part of Transitional Youth Committee.
And Michael Rodriguez.
Here, District 5. Member of the Youth and Family Services and Adult Services.
Elizabeth Stone. Not present. Krista Hayden.
Here, members of the 4th District and members of the Adult Services.
Marlon Torres.
Here, District 5, Reducing Disparities Committee.
Liz Warren.
Here, District 5, the Prevention Committee, first vice chair.
And Janice Gardner.
Janice Gardner, District 3, Chair of the BHAB and the Prevention Committee.
We have a quorum.
Thank you very much. Our interpreter is here. Lourdes, would you like to give our interpretation guidelines, please?
Good afternoon. My colleague Moira and I, Lourdes, are here to interpret simultaneously what happens in this meeting. Please select your language of preference, whether you're bilingual or not, so that you can hear everything in the meeting. People who have open mics or open screens, if you could please turn them off so that it won't interfere with the interpretation sound. Las personas que participen en español, si son tan amables de escoger su idioma de preferencia en Zoom, aunque sean bilingües, y las personas que están usando otro tipo de audios, por favor apagarlos para que no interfiera con nuestra interpretación. Escojan su idioma de preferencia. Gracias.
Okay, thank you very much. Jackie, do we have any requests for emergency circumstances? Or any, okay, yeah, all right, move on then. May I have a motion to approve today's agenda, please?
Second.
Okay, thank you. Are there any changes or comments? Yes, Liz?
Yes, thank you. On page 4, paragraph 11. First Vice Chair Warren commented that staff should will be mindful when discussing travel distance to services, as this can be a barrier for family members and case managers to see out of county clients.
Thank you, Liz. I think you were talking about the minutes. We're just still doing the agenda.
I'm so sorry.
No.
All right, babe, forget you heard that. We'll try again.
Okay. All right. Jennifer, would you please call the roll? Thank you.
Claudia Armand,
Yes.
Soledad Aragon,
Yes.
Nancy Borchert,
Yes.
James Espinoza,
Yes.
Genevieve Flores Haro,
Yes.
CJ Keaveney,
Yes.
Supervisor Matt Levere,
Yes.
Nomi Maruko,
Yes.
Diane McKay,
Yes.
Jennifer Morrison, yes. Dahlia Rockин,
Yes.
Michael Rodriguez,
Yes.
Elizabeth Stone,
Yes.
Chris Tejeda,
Yes.
Marlon Torres,
Yes.
Liz Warren,
Yes.
Janice Gardner.
Yes.
Motion, agenda passed.
Yeah, agenda is approved as written. Thank you. Thanks, Jennifer. Okay, may I have a motion to approve the minutes from September 18th, 2023, please?
So moved.
Second.
Okay, now, are there any changes or edits?
Yes, there is. May I proceed? Yeah. So on page 4, paragraph 11, where it says First Vice Chair Warren commented that staff should will be mindful when discussing travel distance to services, that can be a barrier for family members and case managers to see clients out of county.
Okay, thank you. Are there any other comments or changes to the minutes? Okay, Jennifer, would you call roll, please?
I'll amend my motion to accept the minutes as corrected.
Great, thank you. And whoever,
And I'll accept as well.
okay, thank you, Michael. All right, great. All right, now Jennifer, would you call roll, please?
Claudia Armand,
Yes.
Soledad Aragon,
Yes.
Nancy Borchert,
Yes.
James Espinoza,
Yes.
Genevieve Flores Haro,
Yes.
CJ Keaveney,
Yes.
Supervisor Matt Levere,
Yes.
Nomi Maruko,
Yes.
Diane McKay. Yes. Jennifer Morrison, yes. Dahlia Rockин. Yes. Michael Rodriguez,
Yes.
Elizabeth Stone,
Abstain.
Chris Tejeda,
Yes.
Marlon Torres,
Yes.
Liz Warren,
Yes, as amended.
Janice Gardner.
Yes, as amended. All right, motion passes as amended. Thank you very much. All right, next we have public comments. Are there any public comments? I believe we do have one. Yes, Jackie? Would you please read it? Thank you.
Okay, hello everyone. This is a public comment from Pete Lafayette. There are 2 written comments from him. The peer workforce does not look good with Modernization Act. Current programs funded by MHSA may not be funded under Modernization Act with less funding for the counties. This is a political power grab by our state elected officials, and we all must educate the voters to vote down Proposition 1 in March 2024. $120 million for 8 counties this year and $290 million for the rest of the counties next year for a few targeted population under CARE Corps. MHSA dollars wasn't for CARE Corps along with Cali. We need to make noise now. Second comment, peers must be a part of mental health policy formation. No one else can articulate as factually, historically, organically our movement. It is futile effort. only if the measure is allowed to preempt and erase our historical progress in the process. I'm wondering about starting a mainstream publicity campaign and listing a PAC/other MHSA pro-consumer affiliated California group. Otherwise, the opponent is too powerful and not a close contest. MHSA modernization ballot passage will be like revoking self-determined diversion programs, negatively changing recovery progress for life. The contrast with the Services Act could not be any wider of real people in recovery and wellness versus cold raw institutions, embezzlement and larceny on a scale not seen since the robber baron days. That will be all that's left of the MHSA and not the pure vision, infinite hope and demonstrated results from the survivor culture, where it all originated. Changes in mental health funding headed towards forced treatment and away from peer source recovery and support. If you don't follow the Senate Bill 43, it is setting up for a huge step backwards in process and administration in the MHSA funding. Many agencies who usually register MHSA status quo weigh in Senate Bill 43 having a chilling effect for progress, with the big agencies like NAMI California being in support or others whose budgets stand to be padded by the bill. But the overall curve of consumer testimony for modernization.
Sorry, Jackie, would you mind slowing down, please, because.
Oh, yes, I'm so sorry.
Oh, that's okay.
Didn't follow the Senate Bill 43. It is setting up for a huge step backwards in process and administration and MHSA funding. Many agencies who usually register.
Still trying to get your attention.
More? Okay, I'm sorry. Many agencies who usually register MHSA status quo weigh in Senate Bill 43 having a chilling effect for progress, with that big agencies like NAMI California being in support or others whose budgets stand to be padded by the bill. But the overall curve of consumer testimony for modernization goes against it as it is written and calls for amendments to be made, or it stands to become a quagmire as MHSA already is, to be further co-opted. Thank you.
Okay, thank you very much. Are there any other public comments? All right. Okay, next, and I did want to mention that we can have public comments for any of the agenda items. So if there is anyone that has a public comment, please raise your hand or make yourself known in the room. Thank you. All right, next we have our time certain presentation. It is an eval presentation entitled Continuum Care Needs Assessment, Community Engagement Updates. And I believe that Dr. Alex Herrera will be presenting today on the internet. So go ahead, Alex. Thank you. Welcome. And we look forward to the presentation.
Thank you so much, everyone. I'm going to share my screen. Can everyone see this? Great. Okay. Yes, thank you so much for giving us the opportunity to update you today on the Ventura County Continuum of Care Needs Assessment. Today, I'm going to be doing a brief recap of the needs assessment key activities, and I'm going to update you on 2 of our data collection efforts. I'm going to give you a preliminary update on our community survey, which is ongoing. And I'm also going to give you a brief overview of the provider and partner agency survey findings. I'd like to first take a moment to thank everybody who has helped us with this effort. We have spoken to so many community members, so many providers who have met with us for listening sessions, in-depth interviews that have taken time to complete the surveys that I'm going to be reviewing for you today. We'd also like to thank Mr. Zimmerman and Dr. Dennering and everybody at the HCA team for spearheading this needs assessment. I know so many of you have seen this recap before, but just in case anybody is attending today that hasn't seen this, this needs assessment is aimed at assessing Ventura County's mental health and substance use services and systems of care. We're doing this by collecting data from the community and from providers and people who facilitate access to care on the issues, gaps, and needs and trends of the mental health and substance use system of care. We'll also be obtaining and analyzing mental health and substance use related data from the continuum of care across the county. First, I'm going to show you some preliminary findings for our community survey. Again, data collection for this is ongoing, so this is just kind of a taste of what we have so far. For the community survey, we are starting our recruitment with an email campaign. We have 50 contacts at over 40 organizations that have direct interaction with community members. We have supplied these contacts with flyers, social media posts, email language, and we're asking all of these contacts to please share the community survey with their clients and any other community members that they might interact with. We'll be sending weekly updates of these of the survey response rate to these contacts and reminders to please make sure that flyer is still printed in your waiting room. Please repost to your social channels, share on your listservs, put this in your newsletters if you have one. This official email campaign started just at the beginning of this month, and as of last Monday, we had 284 responses. So I'm going to be showing you the data up to last Monday on those 284 responses. And I just want to point out that this is just our engagement strategy for the first part of this survey. We have engaged with listening sessions with community members, and we've also done in-depth interviews with community members where we utilized other tactics to make sure that we're reaching the community. So we asked community members a number of questions. One of the first questions we want to know is, what do you think are the most important behavioral health issues in your community? And community members saw a list of possible issues that they were able to select. And so what you see here are the top 5 selected issues that community members think face their community. And you can see that 3 out of the 5 are related to substance use, with substance use being the first one, followed by alcoholism, and opioid use disorder is number 3 on this list. So community members really feel like substance use is a major issue in the community. Next, we want to get a sense of whether or not community members believe there are services available for these issues in their community. So we asked if they felt services were available for both mental health and substance use services. And as you can see, for both mental health and substance use, community members, over half of them felt that while there are some services available, they're insufficient to meet the community's needs. So the next thing we're going to want to understand is what's missing? What services do they need that aren't available? And what is preventing them from accessing services that are available? So we next ask, which of the following services are not sufficiently available in your region of the county? And here we have the top 5 responses that we got, and you can see that long-term shelter and relocation, services for individuals who are homeless or unhoused, crisis response, care related to substance use, and advocacy on behalf of persons experiencing mental health or substance use issues were the top 5 items that community members felt are missing from available services. As far as barriers, we asked, what are the barriers to accessing mental health and behavioral health care in Ventura County? Now, respondents saw a list of potential barriers, and they were allowed to select as many barriers as they thought were applicable to their community. And so what you're seeing here is a list ranked from the most selected items to the least selected items. And you can see that the top 2 are lack of information about where to get help and appointment availability. These are followed by cost of services, stigma against mental illness or getting help, a lack of health insurance, distance to available services, a lack of transportation. There was an other option, and this option included write-ins like the wait time from a 5150 hold to getting mental health care, or not having enough staff that can speak to the unique experiences of people of color. These are then followed by lack of childcare and caregiver relief. Staff do not understand different cultures, or staff do not speak my language, or there's no translation available. Next, I want to give you a sense of who we've spoken to so far. I'm going to show you race, ethnicity, The survey language and age, these are not the only demographics that we collected. We have others, but these are the ones that we're showing you today to just give you a sense. So for race ethnicity on the left side, you can see that we do have 31% of people identified as Latino or Hispanic. If you look at the right for survey language, on the other hand, you can see that only 3% are selecting to take the survey in Spanish, suggesting that while we have 31% of people who identify as Latino or Hispanic, only 3% are primarily Spanish speaking, where they are preferring to take the survey in Spanish. For age, we have a really nice spread of age. We have, our big chunk between 30 and 60, but we're still hearing from people on the very ends of the age range, even folks over 80 years old. Next, I'd like to fill you in on our provider and partner agency survey. This survey is completed, and so the findings that I'm going to show you are findings from the overall responses that we received. We followed a similar engagement strategy for this, where we did an email campaign with 57 contacts at over 45 agencies and organizations. And we asked these contacts, please share this survey with your staff, your colleagues, your collaborators, anyone else that you know that might provide services to the community or facilitate access to services. Data collection for this survey was occurred from June to October of this year, and we received 888 individual responses. These first few slides are just going to kind of give you a sense of who we heard from. So when providers logged into the survey to answer questions, they selected what sector they felt they worked in, and you can see 44% of respondents said that they worked in the mental or behavioral health sector, followed by social services, corrections, healthcare, child welfare, education. We then asked, what area of the county do you serve? And almost 3/4 reported serving the entire county. We then asked what services they provided. And again, the top one is mental health treatment, but you can see we had a range of other services. We have linkage to care, mental health prevention, community advocacy, suicide prevention, and substance use prevention. Then we wanted to hear from our providers similar questions to what we asked community members. So for community members, if you recall, we asked them, what is the most important issue in your community? And they rated substance use issues as the top issue in their community. And for providers, we asked them, what's the prevalence of these issues in your community? So basically, how often are you encountering these issues? And they were able to rate a list of issues from either a major issue to not an issue. And from providers' perspective, you can see that the top issues that they're reporting are mental health related issues. We see anxiety, trauma, mild and moderate depression is the top 3. Substance use is up here, but we do have these mental health issues that are rated slightly above. And importantly, you can see that for all of these issues that are rated as major issues, very few people identified these same issues as not an issue, suggesting there is consensus among the providers that these issues are in fact major issues in the community. So again, like community members, we asked, do you feel that there are services available for the community members for these issues? And again, for both mental health and substance use, over half of providers are saying, yes, services are available, but they're insufficient to meet the needs of community members. Then we wanted to hear from providers, what do you think is preventing community members from accessing the services that are available? And again, providers were shown a list of barriers, and they were able to rate these from often a barrier to not a barrier. And you can see that the top 3 are not enough staff to meet the needs of the community, long waiting lists, and residents are unaware of how to access services. And if you can recall to the community member survey, when we asked what the barriers were, number 1 was we don't know where to get services, and number 2 was waiting for appointments. And so these top 3 items really align with what community members are saying is their experience in accessing care. So looking ahead, reports on all of our primary data collection efforts will be forthcoming. So that's going to be a report on those community member listening sessions, community member in-depth interviews, the community member survey once that data collection is complete, as well as the provider and partner agency in-depth interviews and the provider and partner agency survey results that I just went over with you. We'll also be working with agencies to obtain data and statistics on service delivery and identifying gaps and areas to improve across the Ventura County system of care, whereby we'll be able to use all of that data we collected and look at it compared to the data we'll be getting from agencies on what do you have and what is being used, and we'll be able to see what's aligned and what's not. I'd like to thank everyone so much for your time, and I'd be happy to take any questions.
Thank you, Dr. Herrera, and thank you to the Valcor team for all of your hard work. We're now going to take questions for Dr. Herrera or any of the other Valcor staff, but I'm asking if everyone could please ask one question at a time, and I promise that we will circle back for a second question or a third question as time allows. I see Marlene Torres, please.
Thank you, Chair Gardner. Dr. Ricasera, are there any plans to engage the clients for BCBH to get their feedback, or is it just community and providers?
When you say clients of VCBH, are you referring to patients or?
Patients, actual individuals who are receiving the services. So getting
Yes,
their
yes, we would love to. So one of our contacts is at VCBH. So we very much want to hear from people who are getting care. And I do believe that we got word this morning that somebody did post to the VCBH website so that the survey can be accessed through there.
Thank you. Chris?
Hi, thank you for this presentation. My primary question is, since it was a list of pre-populated responses that people could select, as I understand it, how did we go about making that list? Because it seems if the list is kind of predetermined, maybe it was from the stakeholder interviews that were done at the very beginning, or maybe it's based on Valcor's history of working with this population. But it seems like what we're doing right now is ranking issues that we may already know exist in the county without coming up with kind of the other side of it, which is like the novel approach of how do we deal with these gaps in service. And I know that there's a first part of collecting the data, but if it's a pre-populated list, to me, it seems like we might just be ranking issues that we already know might exist in the community. And as somebody that's sit on this board for like 2 or 3 years now, we've seen each of these topics presented by whether it's people making public comments or it's people on the board itself. So that's just kind of what I'd like to know at this point. And I look forward to that data collection from the agencies, that analysis a lot. But I also appreciate your efforts for this too. Thank you.
Yeah, absolutely. I mean, that is a valid question, a valid concern. So on the slide that I have up for you right now, this is like one of those kind of pre-populated. What we don't see on here is that there was an option to select other, and they could write in other items. So it's not only limited to this. But yes, some of these are listed because of, these are barriers that are kind of known to be an issue, right? So we want to make sure that we hit those. But there are options to write in other free form responses that people have experienced or have heard about to make sure that we are getting all of those items.
Thank you.
Okay, next we have Nancy Orchard and then Liz Warren and then Genevieve.
One of my questions was on the center part of the presentation, there is corrections probation and there's law enforcement. It seems like it's all one thing or certainly combined. How and why did you separate them?
Yeah, you know what? That's a great point, and I actually was thinking that I should mention it in the presentation. I think they were separated out because in creating this, they seemed like distinct entities, but then after speaking to more people later on in the data collection effort, when we were really doing our targeted outreach, like, oh, we haven't heard from enough law enforcement, we need to get in touch with everyone we can. We started talking to people and they're like, oh, but you have this great rate for corrections and probation, and these are kind of linked together. I think the reason it comes up like this in this list here is, again, there were a list of sectors and then an other option that people could put in. And so if someone worked in corrections and probation, they most likely selected that and not law enforcement. So they kind of got split up by self-selection. But yes, I very much agree that they could be put together, and other people we spoke to said the same thing.
Okay, thank you. Ms. Warren?
Thank you. So staying on that same slide, I have a couple quick questions. You were listing, I guess, the more specific areas, and I didn't get them, and I'm wondering if you could just run through them. You talked about asking what this was: mental health prevention, mental health service. You did a list, and I just didn't get it all. Could you just say it again a little slower?
Sure. So I want to make sure that we're looking at the right slide. So there's this sector slide here, but we also had this slide, services provided.
No, it's the same one that Nancy Borchard was just on. They had the
Okay.
breakdown of sectors in the community.
Sure, yeah. So it's mental and behavioral health, social services, corrections, probation, healthcare, child welfare, education, other, and some of the responses in here were things like, I work at a community-based organization, but there's no information on what the organization does. Or some people wrote in their job titles, so they couldn't really be assigned to a sector.
Okay, thank
Law
you so
enforcement.
Liz, I'm sorry, we're gonna get to the next person. Okay, Genevieve, and then Dahlia, and then Claudia. And then we'll circle back if we have time. Thank you.
And thank you so much for the presentation, Jenny Flores-Haro. I have a question as far as when data is presented to us in the future, as it relates to this particular work that's being done. I know we're looking at it at very like high level, and everything's combined, but I think that demographic piece is so important to parse out responses. So for example, if we go to who we've heard from thus far, I'd be curious what that 3%, what their breakdown was as far as what their barriers were, just to get a better sense. Because right now, the way it reads is all we have to do is inform people, and you know, a lot of us in the room, we know that that's not the case. So I'd like to see breakdowns as far as, you know, of the 97%, what did that look like for them in English, for the 3% in Spanish, what is their breakdown as far as, again, barriers and what they're worried about. And I'm just wondering if we can get that data more segmented next time. Thank you.
Thanks, Genevieve.
Yeah.
Dahlia? Oh, did you want to comment on that, Alex? I think she was asking.
Oh no, I just wanted to say thank you for bringing that up, and that's absolutely such a good point, and certainly something that would be looked at in the reports, and something we will definitely keep in mind in the future.
Great, go ahead, Dahlia.
Thank you for your presentation. I understand that there are not enough providers, obviously, to see all these patients. And at the same time, as a mental health provider, I understand working with insurance companies is very challenging, and a lot of providers don't want to work with companies like that. But why can't we use interns and trainees for these purposes?
I'm sorry, can you repeat the question one more time? What can we use as trainings?
Yeah, why can't you use interns and trainees for, you know, using their services for this population, and then we train them, and at the same time, you know, you guys can use them?
Yeah, that's such a good question. This would not be my area of expertise, but I imagine that there are probably some kind of regulatory rules on how much experience someone needs before they can practice on their own. But I certainly think that that is something that can be looked into, and kind of figuring out what are the requirements around that? How can trainees be more involved to kind of help with the staffing shortages that everyone's experiencing?
I just wanted, hi, Loretta Dennery, acting behavioral health director. I just wanted to clarify that we do use interns and we have practicums. So we do have students who work, and as the course of them developing their hours for licensure, they're able to provide services. They're actually able to bill under the license of their supervisor. And the state allows this under Medi-Cal for both mental health and substance use.
Thank you. I think we had Claudia and then Michael. Someone else have their, oh, CJ. Okay, thank you.
I just wanted to add some suggestions for trying to increase the input from the Spanish speaking community. And I just think about some of the grassroots organizations that I work with in the community and some of the strategies that they use, but you know, having paper surveys like at places like the swap meet would be one idea. And I also think of the great work that Westminster Free Clinic does in Thousand Oaks and Simi Valley. And they go to the Latino markets and they set up a little table, and that's, as people are coming and going, that's how they interact with the community. And then I also think about how important it is to get the input of people inside the jail, because we have a significant population of people with mental illness that are incarcerated. And so what is their way to provide input? And then it makes me think of another community organization in Santa Barbara that sets up a table at the jail during visiting day so that they can interact with the families, and the families can share what the challenges that their incarcerated family members are facing. So just a couple of ideas.
Thanks, Claudia. Okay, CJ, Michael, CJ, and then Elizabeth Stone. And Raton, one of our community members, nominee member, has a question also. Go ahead, please. CJ. Oh, Michael first.
Right, thank you for that very informative presentation. On the slide for area of county served, I'm somewhat, as a resident of the East County, I'm really surprised to see how low that percentage of service providers are. Is it because that those are the only responses you got, or the number of services providers in the East County is that low?
No, so this wouldn't be, it isn't only that 9% only serve or that only 9% of folks have services in the East County. So they could select one option here. Their options were to say that they only provide services to the East County, or only to the West County, or county-wide. So the 72% that make up the county-wide also have folks that are serving the East County. So East County would really be like the 72% plus the 9%.
Okay, thank you. So we have Michael, Elizabeth, and Raton.
Good afternoon, thank you for your presentation. I had a question with respect to the folks that you've heard from thus far. I noticed ages 10 through 19 is at 0%. What efforts are being made to reach out to children and youth regarding the needs, their perspectives of the gaps in services and their needs?
Yeah, absolutely. So this is just the first part of our engagement, that email campaign. And then as these data come in and we kind of see that we have, down spots like this age range, we can adjust our strategy and try to do more targeted outreach. So for something like this, it would be really trying to get involved with folks that are working at the schools. Can we get a survey out on whatever like online platforms schools use these days to the students for homework and things? Or can we print out the surveys and put them in backpacks? How can we get these to the students?
Okay, thank you. Elizabeth Stone.
I've been struggling like how to say my concerns nicely. So I have two kind of basic concerns that link. And a lot of it has to do with the language and also kind of piggybacks on what Genevieve was asking about the way things are linked. Some of the language is so vague to me. Some of the labeling that you were using has a very different meaning than in literature that I've read or my understanding of it. Some of the statements that you're making when you read what the question is and give the implication of it, really, to me, is not necessarily linking. And part of that then, to me, confounds what you're finding, because it's really hard to discern what's first of all, assessing needs. I'm like, that's so vague. What are we actually looking at? But just to try to like figure out who is answering what. It's 67% is mental health, behavioral health, which of course actually behavioral health includes mental health. But if the majority of that is VCBH, are people saying that agency serving the entire county? Like there's not enough specificity for me, or it'd be really helpful to understand the findings. And then for me, the language is rather imprecise, again, to be able to extrapolate and, kind of as Chris was suggesting at, what are we really finding? What are we looking at? How are we getting people's perceptions? The 5 people, there were no substance use providers, it looks like, that answered, so those answers are kind of skewed. There's a very large Asian Pacific Islander community here. A lot of people speak Tagalog. So there's lots of stuff that seems a little imprecise to me, and I find that concerning. Thank you for letting me share.
Thanks, Elizabeth. Did you want to address that, Alex, or go ahead?
Yeah, thank you so much for sharing those concerns. And I certainly understand where you're coming from. I think the survey is kind of like a support buttress to those in-depth interviews that we've done with folks. And so this is just a way for us to get snippets of information from a wider range of people to again, support and add on to those other more in-depth avenues that we have taken to hear from people. But I certainly do understand what you're saying. And thank you very much for sharing it.
Thanks, Alex. Okay, Ratan Bhavnani.
Thank you. This is a public comment. My name is Ratan Bhavnani. Thank you for your results of the survey here. I'm sure the information is very useful. I'm a former member of the Behavioral Health Advisory Board, and when we were looking to do this needs assessment, among the things that we were more concerned about, in addition to these responses, was how are we doing in terms of, do we have the right number of beds in our programs, or do we have the right number of slots in our programs, CSUs and IPUs and so on? Do we have the right number of housing beds available to the important cares or MHRCs and so on? So these results of these surveys are fine from an individual's perspective, who's looking at their worldview, or from a collection of individuals, or similarly from a collection of agencies that you have worked with. But we were also, at least I was also hoping that you would bring your expertise about how we are doing compared to other counties our size or similar counties. And are we on the right track? Do we have the right services? Do we have the right quantity of services as well? So thank you for allowing me to make that comment.
Thank you, Ratan. Go ahead, James.
Well, thank you for the presentation. James Espinoza, I'm a veteran representative. I'm also in law enforcement, so I just have a couple of points and some points for consideration. Number one, the first thing is I don't see military veterans categorized in the sector. Secondarily, that's probably just the first concern, but secondarily, just to comment about the distinction between law enforcement and corrections or probation. I think typically for me, I've been nearly 20 years in law enforcement, there's a clear distinction. I don't know what the questions are that are different or if they're all the same, But in law enforcement, we typically encounter people when they're in crisis. So their responses may be different than someone who's in corrections or probation, where they already may have been referred out to services or had mandated services as part of their sentencing or diversion. So having that distinction to me is not problematic. So I'll just like you to keep that under consideration. And also please consider adding military veterans to this sector.
Okay, thank you. Did you want to respond to that, Alex? We have one more question.
Just to say thank you very much. I appreciate the insight and for helping us make that distinction.
Thank you, Alex. Okay, we have Diane, go ahead.
Mine's more of a comment just for help in East County. To Claudia's point, the Westminster Free Clinic, but there's also Safe Passage and Adelante both have Saturday, activities that could get you answers if people went to those. The Struggles Hospital could help. I'm sure there's similar things in Simi Valley. It just seems strange that it's a statistical anomaly that there's such a small percentage of East County. But you're saying that's because they're the ones that identify as only East County? Wouldn't we want to see only West County, only East County, and then sort of who does both or who does everything to have it be more meaningful? If we could see that, it would be great. And I'm happy to pass along those organizations to you. I can email them or send them to Janice, but I think that they would really help you reach those students at Canale Elementary, Glenwood. We know where they are.
That would be fantastic. And for anybody, if you have contacts at anywhere where we would be able to get a population that we already know might be underserved or that we're seeing coming in, we would love to hear from you and get those contacts so we can make sure that we're reaching everybody. That would be fantastic.
Okay, thank you. We have time for one more comment or question. Soledad Barragán.
Buenas tardes, mi nombre es Soledad Barragán y yo lo que escuché y me preocupé fue cuando ella dijo que había solo un 3% había hecho la encuesta o había querido hacerla en español.
Good afternoon. I got a little concerned because it says that only 3% were able to get to the questions, to the survey.
Mi pregunta es, solamente lo quisieron hacer en español porque los entendían perfecto el inglés.
Did you want to do it in Spanish because they perfectly understood English?
Dieron esas encuestas.
And where did you distribute?
Con respecto a lo que dice Claudia y la señorita.
And regarding to Claudia says, and also this young lady.
Hay muchos lugares, un ejemplo, yo trabajo cerca de las escuelas.
There are so many places. I work near the schools.
Septiembre y octubre fueron las fechas de los back to school nights.
During September and October, when they have back to school nights.
Donde tuvimos la oportunidad de estar varias agencias, en algunas Mire Logrando Bienestar, en otras.
Some of us organizations like Logrando Bienestar and others were able to be there.
Pero en ninguna se dio ni una encuesta y allí había oportunidad, pues hay muchísimos padres.
But we did not see any surveys, and it was a good opportunity because there are a lot of parents that come there.
Miembros de la familia donde podemos dar esas encuestas.
También family members that we could distribute the surveys to.
Nosotros, yo estoy en una organización que se llama Padres Juntos. Y
I am part of an organization that is called Padres Juntos or Parents United.
Estamos, como dice Claudia, en las escuelas, en la comunidad.
Like Claudia said, we're in the schools, we're in the community.
Nos encantaría ir a la cárcel, pues muy buena idea.
We would love to go to the jail. That was a really good idea.
Porque estando en la cárcel no dejan de ser padres y no dejan de estar enfermos.
Because they're parents and there are sick people in jail too.
Entonces sí me preocupa a quiénes o a qué personas están llegando porque el 3%.
I am concerned who you are reaching. 3% is very low.
De antemano puedo decir a la organización está a disposición de ustedes.
I am letting you know my organization is available to you.
de cualquier encuesta, cualquier situación para poder informar a la comunidad.
Any survey, any information, anything you want us to communicate to the community.
Thank you, Soledad. And we have another comment from a community member, Cece.
Hi, I am Cece Casey, and I sat on the mental health board in 2005. I just wanted to note on the prevalence in the community. It has many instances of disorders that come back to reality. I noticed bipolar is on there. Once they've been through an episode, they will revert back to reality, but schizophrenia doesn't, for the most part. There's about 65% of those who suffer from lack of insight. So your crisis is extremely important for those folks. And so it would be helpful as they go through many of your programs for those people to have prevention and early intervention to prevent them from the continuous cycling that does happen. And your crisis stabilization units for them are very important. Crisis mobile unit would be very important to have. And I just noted that on the page before that, sector page, what was it after that? Where the public guardian did not have input. They will usually end up with those folks that have this lack of insight, schizophrenia, and maybe other very severe illness as it continues to progress. So I just wanted to point those things out to you.
Okay, we have time for one more question. Well, actually, Liz had her hand up again. I have two more questions. Please, only one question now, please, or comment. Thank you.
Thank you. So I just wanted to comment on what Michael said, because that was an area of concern that I also had. And I just wanted to add that under targeted outreach, that you should be chatting with folks at the wellness centers that are at the various schools throughout the county. And at some point, I'd like to know what the other options were, and if that if information can be shared. And lastly, as a friendly reminder, I would like folks to use some recovery language here and refer to individuals as clients, not patients. Thank you.
Thanks, Liz. And who was the last? Sorry. Oh, Jennifer, go ahead.
Hi, Alex. Thank you for your presentation. Cece had some good points, which made me think about, did you tap into the RISE and EPICS teams to interview clients that are in those programs?
I don't know if someone on my team can help me with the interviews on who was tapped in. I know that we got to RISE for the provider surveys, but I'm not sure if anyone from RISE was in the interviews. I can look that up though and get that information to you.
Yeah, I think that's a good set of the community that you can reach is through those programs, since they have their contact information and they're currently in treatment. So that would be a good source.
And Alex, can you please put the slide with your email address on it so that everyone in the room has it? So again, the survey is one component of the comprehensive needs assessment. And so we definitely need your help in helping get the survey to more folks. And I know the number of you generously offered. So Alex's email is there. You can find her online too and call her, but we definitely would like your assistance in pushing the survey out further. And the first phase of this project has been primary data collection. So there's 2 surveys, there were listening sessions, there were 2 sets of interviews. So there were 5 activities that we did that were collecting data directly. The next phase of the project is going to be getting at what some of you brought up with the number of beds we currently have, the number of beds that are needed. But just please keep in mind that the survey is one of about 11 or 16 different things that we're doing, and we need your help getting the survey completed by more folks who choose to take it in Spanish, but also the age range that you brought up, as well as hearing more directly from clients. And we just appreciate your support in pushing the survey to more folks. As you saw, we had almost 900 providers respond, and we want to do that and more, certainly, with hearing from community, and we can't do that without your help. Thank you.
Thank you, Dr. Donovan. Are you sticking around, or do you need to leave, Dr. Donovan, Alex, and team?
We're planning to stay for the whole meeting.
You are, okay.
Thank you.
So I just wanted to mention that we never know exactly how long our other BHAB business will take. So if we have time at the end of the meeting, we would love to have more questions or comments as time allows. So thank you for sticking around. We appreciate your time and effort and all of the work that you put in, and for listening to our comments and to our community as well. Thank you. Okay, next, there are a few chair comments. During the executive committee, I mentioned that the BHAB's task, our task, is to represent the community at large as a whole and in the districts in which we serve. And so if you have any questions, if you're a new BHAB member or someone from the community and you have questions about anything, please email me or any of the officers or fellow BHAB members, or email me and I'll get it to the proper person, because I know when I was new, it was pretty daunting to try and understand what all the acronyms were and how a department runs, and behavioral health, and also other areas of our business. So please feel free to open up and reach out. Thank you. Okay, I wanted to thank Dr. John Shipper and Hillary Carson and Juan Sanchez for taking the time in the afternoon and even until 9 o'clock at night in the evening for putting on the MHSA community planning process. Fiscal year 2023-26, Liz Warren had sent out an email to the executive committee outlining some of the details for that evening and also for the virtual meeting that was held in the afternoon. A copy of the community planning process presentation is attached in our director's report. So please take a look at that. And I would encourage everyone on the BHAB that if the department has, or any of the other agencies have community planning meetings, that if you could possibly make it, that would be great. There were only 2 of us that attended, and the department does want input from us. And so I encourage everyone to attend in the future. I also wanted to say, hold on a second. Yes, okay. Dr. Shipper, are you still over here?
He's still here.
Okay, hi, Dr. Shipper. I not to put you on the spot, but I wanted to mention that Dr. Shipper, one of the slides in the community planning process presentation mentions a $30 million one-time funding that MHSA has received from the state. And Dr. Shipper mentioned that evening that 20 million of that is being considered to help build an additional mental health rehabilitation center on Lewis Road. And this is pending approval from the state. But the mental health rehabilitation center, the second one, has been supported by BHAB members, and we've anticipated this to be built. There's also a partner, apparently, I would let Dr. Jennering address, but a partner that is willing to build it, but I know that there are a lot of things and processes that have to come before that, but the county does have the land, and so I personally am hoping that that facility will be built. Okay, I also wanted to mention a couple of other things. Oxnard Vagabond Inn is to become a permanent housing for homeless residents. 2 organizations completed their purchase of the Oxnard's Vagabond Inn on September 18th, paving the way for permanent supportive housing on the site. Casa Aliento is what the project is called, and it will transform the 70-unit motel into apartments to house the area's homeless population. The former inn is currently being used as a shelter. And it's, there was an article that says the developer is partnering with Mercy House. It's also a county funded partnership, I believe. All right. I believe, okay. And they're partnering with Mercy House, who will operate the facility and provide wraparound services to the residents. Casa Aliento will also have several managers and treatment specialists who work with residents. An on-site manager will also monitor the property. Okay, the last comment I have is that on 9/27 at the Ventura County Office of Education, DCBH and the Superintendent of Schools held the Facing Down Fentanyl Town Hall. Numerous members of the community who had lost loved ones due to fentanyl overdoses were present. Fentanyl is an illicit drug which youth and adults can buy in the street on social media outlets such as Craigslist, Instagram, and others. Fentanyl overdoses hit all ages. More than half of the 181 people who died in Ventura County last year from fentanyl overdoses were ages 31 to 50, statistics show. Dr. Dennering facilitated the evening, and there was community input and questions, which were answered by key leaders in the county who presided on the panel. So that's it for chair comments. Next, we have the director's report. Dr. Dennering.
Good afternoon. I will be brief. We have a very extensive director's report included in your packet this afternoon. So if you have any questions about any specific area, please let me know. Obviously, last week at the executive committee meeting, I notified the executive committee, and at the time via email this full board of the action taken with Vista Del Mar regarding the suspension of their LPS designation and suspension for involuntary admissions. So again, this full behavioral health advisory board was notified publicly once the release was issued, but I wanted to just state in this meeting with the full board, as I did last week, that the action occurred. So effective this morning at 8 a.m. In addition, this is a very heavy audit and review time for the department. This morning, we held our what used to be known as the DHCS Mental Health Plan Triennial and DMC ODS SABG Annual Review, actually three separate reviews that have been combined into one total review that the state is now referring to as the DHCS County Specific Engagement. Began this morning. So myself, our leadership team, and a team of about 40 staff had the opening session with the state. They will be here for a 7 to 10 day review period, going through the entire department since they're doing it all at once. So I mean, we'll see. So this is new for them, new for us. The good thing for us is that our teams all worked on those three reviews that are now collapsed. It's the same folks within the department. It'll be different for the state because this is combining groups who previously hadn't done audits together. So this is the first run it, so we'll see how it goes. We also last month, at the end of the month, had our MHSA 3-year program review, which was from September 26th to the 28th. And we had sessions, site reviews across the county, and we had a closing review with the state. They were very impressed with our levels of collaboration within the county, especially with our law enforcement and probation partners and our jail services. The fact that we all work very closely, not only with the county partners, but then within our CBO networks, that our CBOs also work very closely with some of our county partners. And so they were very impressed by that. And so it's a wonderful review. They were sadly didn't have time to just see everything in the county. These folks were from Sacramento and a couple had never been down here, and they just noted just how drastically different the county is from, you know, one side to the other and even within certain pockets of the county. So they will build that into the next review so that they have more time to actually go look, because they found that very interesting. So and then coming up in December, we're already prepping for our combined mental health plan and DMCODS plan EQRO visits. So that'll be the first week of December 5th through 7th. And as many of you are aware, we do often have folks from the Behavioral Health Advisory Board participate on sessions and opening sessions. So look out for that when it comes. And a couple of more updates. Wanted to note that on September 21st, we announced a new opportunity regarding Medi-Cal peer specialist certifications for our contract providers. The department has purchased a limited number of bundles to be awarded to CBO programs with peer staff that meet the certification requirements. And so what is all included is in the bundle is included here in the report. And interested programs can complete the application and send it to our email address, also included here, by October 6th to be considered. Also wanted to note that we have joined in with the Department of Health Care Services on the Behavioral Health Administration integration as an early adopter county. So our representatives attended the first meeting of the work group with the state related to integrated contract early implementers. Again, working side by side with the state as we work towards administrative integration. And what that is again, combining mental health and substance use formally, contractually through an integrated contract with the state. So as it stands now in our current system, we have 2 contracts, one for DMCODS services, one for mental health services. And the state intends to combine all of that and align all of the quality metrics reporting, all of the administrative integration, clinical integration, and eventually finance. So we will be at the table with the state as they work through this. All counties will be required to integrate fully by 2027. So we will be well ahead of that since we're participating early. And that is it. Available to take any questions. Go ahead, Chris.
Thank you for your report. I was reading through that mental health plan, and there was one part that was that caught my eye was the Medicare that it was contracted for Medicare certification. It was like one of the findings or one of the ECBH was using a contractor to facilitate that Medicare qualification. Or could you tell me more about that or how that process works?
Can you tell me what page you're referring to?
Oh, I'll bring it up. There you go.
Okay.
Thank you.
No problem.
Sorry, yeah. So I had a question under family and youth, that's not on, sorry, on page 5, on the codes paragraph. And, you know, it sounds like a great program. I'm not sure what ERSES refers to from, and I mean, I know what an IEP is, but.
Sure. So ERSES is our educationally related social and emotional services. So those are school-based services that we work with districts, individual districts to provide. It's a higher level service based on collaboration with BCBH and the districts and schools.
Okay, so the child has to have an IEP first, and then they have this additional designation.
Yes.
In the IEP. Okay, so I have a kind of off. Well, kind of thinking question, which I'm just curious about. You know, there's a lot of need for child services in this county that, for people who have private insurance. And I assume they don't qualify for any of these, which sound like fantastic programs, a lot of these that are, outlined here, some really good programs for families and children. So if you have private insurance, you can't take advantage of these, I'm assuming. And that's the first part. And the second part is there a way forever for the county to provide services to people who have private insurance?
So the short answer is not necessarily, they're not necessarily excluded. So it really depends, and it's a case by case basis, and it really involves county working directly with the schools and the insurance companies. But it's not necessarily an exclusion. To your second question, there has been legislation passed recently to establish mental health parity across the private insurance sector, to require them to meet the same standards that we meet in the public sector, which are significantly higher. So that's why you may have seen an uptick in hiring at Kaiser, Blue Shield, all the private insurance companies, contributing to some of the workforce crisis that we have. Is because clinicians are going over into those private areas because they have the same mandates and requirements we have now in the public sector. So eventually they will all be aligned, so that regardless of payer, you will receive the same type of services.
Okay, thank you. Right, does somebody have questions here?
Jennifer is. Thank you, Dr. Jenner. So I've been on the advisory board, I think 3 years now, and this is my first experience hearing of an institution having their LPS revoked. So it brought up a lot of questions for me. I recall you saying at the executive meeting that you were investigating for 18 months. And I'm not sure what the responsibility is or how the collaboration goes with the advisory board, but I was just a little bit surprised that we were just finding out about the complaints or that there were issues right before you were going to revoke their LPS status. I did read in the BC Star some pretty awful allegations that are going on. And I was curious also during that investigation period, knowing about the complaints, were we as a department referring clients into Vista during this time?
So I could say that as far as the complaints obviously go directly to the California Department of Public Health, where all complaints, since I don't know, however long they keep them available, are listed. Where anyone, whether it's a staff, an employee, a family member, an individual client, can make a complaint directly to the state. The facility has been under a corrective action plan, which is not uncommon for pretty much all CBOs at certain times and all entities to be under. And so we have been regularly monitoring and engaging with them as we would any other provider. And so they have, it's been a very clear path over the last 18 months as far as actions that needed to be completed on their part. And as stated in the letter, the responses were insufficient.
And regarding the communication with the advisory board and that we were not aware of anything going on, how is that typically, is that how this typically works to find out so late in the situation?
So this is a very atypical situation, but as in any contracted provider, as the advisory board, you can inquire about the status of any, organization that we contract with. So the information was provided as part of the action taken, but had there been any inquiries from this board, we would have been able to discuss.
So information can flow one way, but not the other way. If we didn't know there was an issue to ask questions, so that's curious. So information go your way, but you can't come to us with information.
We can upon request. Like I said, it's not uncommon for any CBO to be under a corrective action. So that piece of it is fairly typical.
Okay, I think, I mean, for me, and I don't know how the other board members feel like, but if this were to happen again, I would like to know that something like this is under investigation or that there are some issues going on so that we can participate in any way that you might find helpful. I don't know, I'd like to hear from my other BHAB members on the subject. Thank you. So a couple of good questions. You talked about the peer bundling, but you gave a deadline of October 6th.
Oh,
So I just want to know what the actual deadline was. I know. I just want to get back to this.
Then I thought, I read something out there, was you said it in 17, I had to just put it in.
It was, okay, thank you. So I just wanted to comment on what Jennifer Morrison just said. I know that CBOs go under corrective action as part of the licensing process, but how are we supposed to know to inquire in our oversight and accountability role that you're actually doing something at this level with a corrective action? So we don't know that Mrs. Del Mar is being looked at and having an 18-month very serious investigation unless somebody tells us. We know that those of us that are aware of licensing, we know this goes on all the time. And so to your point, that's correct. But something that's at this level, how would we find out about this?
So that's a great point. So the initial notice that became public and was mentioned in this very meeting was the June notice of violation.
Where did that June notice of violation go after an 18-month investigation?
So the June notice of violation was announced by Director Gilman that the initial action had been taken against Mr. Del Mar.
Well, I know that he filed it. I know that that's the case, but what was happening in the 18 months leading up to the filing of the, I guess, the complaint?
So the notice of violation, which again was discussed in this meeting, outlined some of the areas that were under investigation that ultimately resulted in the notice of LPS suspension.
I understand that, and I won't say anything else, Janice. I just want to really quickly wrap up. So we, as a oversight and accountability board, would have liked to have known about it at the beginning of the 18-month review, not at the end when an action had been decided to be made. Thank you.
I think Nancy was next. And then
I wonder if we can just, as a board, request any corrective action plans that are going on with any of the contracts that are out there. Can we just ask for that? I mean, we can ask for it. Maybe there's 100 of them, or maybe there's 2. You know, I don't know if I'm asking something impossible, but it would seem like that would be something we could request on a regular basis.
Yes. Okay. Or a medium. Okay. Well, this is Michael. You're next.
Good afternoon. Does the department disclose every complaint or every investigation conducted, and why or why not?
Thank you for that question. No, the answer is no, because again, as these contracts are very extensive, ourselves included with the Department of Healthcare Services, there are always times when facilities, community-based organizations, or any contractual obligation provided where you're subject to a corrective action plan. That is not necessarily a bad thing, it's just something you have to correct. So unless there's a reason to disclose, you know, it's a part of the normal course of business. In this instance, the first action that was taken, which set the stage for the revocation that's effective today, was in the June notice of violation, which was presented to this board.
So Dr. Dennery, is it safe to say then that if a CBO or contractor complies with a corrective, what's it called, a corrective action plan, then there may be no further process.
Correct. So when you're under a corrective action plan, You work with the entity, whether it's the department, whether in our case, the Department of Care Services, you work through the corrections. And once the responses are found to be sufficient, the action is closed. You receive usually a written communication indicating that you corrected everything and that the matter is settled.
Yes. Okay, hold on. All right, let's, hold on. I believe, Regina.
She's not on the phone.
Sorry. Yes, Regina, I'll get to it. I know, we have to finish the board first, and then, okay, go ahead. So, all right, Elizabeth, you next. Ready?
Okay, there's 2 points that I'd like to make, and then I wanted to answer your question more fully. First, I really appreciated this list of all these programs under the youth and children. It was really nice to actually see what they were, so thank you very much. Second, I'm hoping the QMAC is going to be meeting soon again. Feels like it's been over a year since we've been able to participate in that. And then let me just, before I get going. In SB 326, which just got signed, right? One of the caveats is, or one of the points in that 200-page bill is for all county behavioral health departments to sign MOUs with private insurance companies so that they can be a provider or to become a provider for the services, as you kind of mentioned. So, you know, we're moving to fee for service, and that's part of how they're doing it, is holding the private insurance companies accountable so that they can pay for the services that the county is providing.
Yes. I believe it's your next. I'm sorry.
Thank you for that question about the QMAC. So to my knowledge, this had been reported out to the board, but the QMAC, as part of our QOC, which is our quality of care committee, the entire process has been revamped and formed to the QIC. And so the functions of the QMAC will be integrated into a new subcommittee, which will fulfill the duties that that group was doing plus additional work. And so information on that is forthcoming, Elizabeth.
Right, because it's been over a year since we've met. That's why I'm kind of like, and I know you're doing a lot of work and setting what outcome measures are. So
yes,
in my mind, it's really important that people that have lived experience of receiving services participate in quality of life measures, not being jailed kind of stuff.
Absolutely. And now that our quality division has been, our leadership is in place in the quality care division, they will be working on that, and information is forthcoming on that revamping.
Thank you. Yeah, I was going to say some of this during the board member comments, but I think going forward from what we're defined with the welfare and institution code and our ability to look into psychiatric facilities, mock placements, and things like that, we really don't have a mechanism to do that right now that's well defined. So as Nancy mentioned, if I don't know how that works, if we just have an open request to receive any information, but I think our board really needs to work together to have a mechanism that's ongoing that reviews these issues or these possibilities. And I appreciate your openness to provide that. The limitation I see though is we have Vista Del Mar and we have the IPU. Now we don't have Vista Del Mar, but we also have the jail. And we've seen over the last few years the heavy expansion of the TIMU and the capacity to hold and house and provide medication and well have to provide, services in the jail. So our ratio of helping people outside of locked facilities, it's just messed up, right? So I really like to see us somehow, somehow be able to have a mechanism where we could review things on an ongoing basis and address red flags before they get to the point where they are now. And I couldn't agree more with what Jennifer was saying is for us to continue to send people to Vista Del Mar through a contract when we know that there's some things going on that are, awful. I think our board really needs to take some steps to develop the mechanisms to prevent that from ever happening in the future. And I appreciate the efforts to grow expansion on Lewis Road, and I really hope that happens, but I know that's a lot of years away, so thank you.
Thank you, Chris. And just to clarify, we do not have a contract with Vista Del Mar. The contract lapsed in June and the department opted not to renew. So we do not have a contract with them, to clarify. And also, again, I'm more than happy to work, and I think that's a conversation to determine what exactly it is you want so that everyone gets what they want. Being mindful of staff time, given the insurmountable amounts of corrective action plans we have, given the size of our department, so that we're making the best use of everyone's time and not actually getting the information that will be helpful to you in your role as advisory board members.
Thank you.
Thank you. If we could, 1 second, Genevieve, if we could, Jackie, put that on the agenda for us to discuss next month about some process with the department that we could utilize so that we can be informed of information that has come forth. Or something to that effect. If any BHAB member wants to shoot me an email and we can discuss it, that would be great. Okay, whose hand was up next? And please don't forget that we do have chair comments coming up, so go ahead, Claudia.
Yeah, just related to Vista Del Mar, I was just thinking maybe at a future meeting, we could have a report on kind of what is the department planning to do in the short term to serve the clients that would otherwise have gone there, and particularly the youth, since we don't have another youth facility. Thank you.
I can briefly respond to that because obviously this has been well thought out and we've had plans. So currently, as of today, out of county or youth will have to be served out of county. So we have developed a plan, increased efforts as far as crisis stabilization, crisis intervention, preventing unnecessarily hospitalizations, but also working with our partners out of county to secure facilities. We already sent youth under age 12, so Vista Del Mar already only served 12 to 17. So we already have established relationships with other facilities out of county. So just increasing those efforts in those areas for youth and also for adults.
Genevieve, go ahead, Genevieve.
Hello, I just wanted a gentle reminder to all of us to use our microphones to make sure that the space continues to be accessible for our interpreters. I know they're doing their best and it's hard when we're not all mic'd up. And secondly, I really appreciate Jenna's request for Jackie. I was gonna ask for something similar. I don't know, maybe other BHAB members are aware as well, just as far as even just the process, like what does that look like from you get a complaint that initiates the process right to where we ended up with the what happened with Vista Del Mar. So I know that would be helpful for me, and I don't know if that needs to happen in this meeting or maybe one of the committees. But definitely a process-minded presentation will be very helpful, so that we know what to look at for the future, because we did receive something in June, but you know, it seems like a lot of folks, it didn't raise any flags at that point for folks. It'd be good to know what to look out for. Thank you.
Thanks, Genevieve.
Okay, if there are no further questions. Oh, okay, yes. One more question and then we'll move on to the other agenda items. And then if we have any further questions or concerns, please raise your hand during board member comments.
Thank you, Dr.
Public comments.
For your updates on Vista Del Mar. Yes, it's unfortunate blow to our county. Even though we may not have a contract for adults, there are many adults who have been living there under Medicare or private insurance and so on, as well as other counties who are in contract with Vista Del Mar. I hear from them that they are quite upset that this has gone way to them. For instance, I believe Santa Clarita area, Santa Barbara counties and so on. But my question to you is, do you think it's a possibility, or is it, I would be hopeful that is there some way that Vista Del Mar could be reinstated with the LPS license at some point? Is that a possibility?
Vista Del Mar has been presented with a path forward. If they choose to accept it.
And do they have a deadline to do that?
Yes, well, The next step is on December 5th. I will be going to the board to either uphold the suspension and say they are making progress in that area. We will continue the suspension until things have been remedied, or I will recommend to the board of supervisors to terminate.
Okay, keep our fingers crossed. Thank you for that. The second question I have was, the US Congress seems to be stalled because the Republicans can't find a leader. Now, I'm glad that our department is working along nicely without the leader. But is Dr. Billman coming back? Are we going to be finding a new director? I'm going to do a great job. Thank you.
I have no information on that.
Thank you, everyone, for your participation. Thank you, Dr. Dennering, for answering our questions. Next, we have the BHAB committee reports. So if we could please have Marlene Torres, who will be giving the disparities reduction committee report.
Chair Gardner, I'll be brief. We met on October 3rd. It was a meeting outside our regular schedule. Unfortunately, some members were unable to attend due to other prior commitments. So we were not able to have a full quorum to conduct business. Soledad and I were there, and we also have a new member, Jessica, who has joined. Our next regular meeting is on November 7th at 4:30 p.m. We'll talk about meeting dates and times for the coming year, making sure that everyone's able to attend. If you are a new member of the BHAB and you are shopping around for a committee, please consider joining our committee. Also, if you're a member at large, a member of the community, and you'd like to join our committee, please consider joining us. We do have a recently added voting member who is not necessarily a BHAB member, but a member of the community who will be supporting our efforts. What time is it? 4:30. Yeah. Yeah. Yes, here in this location.
Great, thank you very much. Next, we have, Kevin is not here today. So is there anyone else who's going to do the Youth and Family Committee update? We can postpone it. So next, my phone, and maybe. Okay, all right, thank you. All right, well, we did not have a quorum this. Okay. Thank you.
I'm sorry, we did not have a quorum, so we did not take any action. We did have a presenter though.
Thank you. Okay, for the Prevention Committee, Chris Ridge from the Ventura County Office of Education gave a comprehensive and educational presentation concerning VCOE's health and prevention programs, prevention early intervention, and the wellness centers. Ventura County Office of Ed Prevention and Early Intervention Program activities track the numbers of participants, and they keep data on referrals for their early intervention services, trainings, and family events. Screenings include trainings and awareness for school staff, students, and families on mental health or mental wellness, stress management, trauma-informed practices, crisis intervention, suicide awareness and prevention, cultural and linguistic competency and equity for the vulnerable and at-home populations. The Wellness Center services includes linkage to mental health resources, in-school referrals, screenings, counseling services, improving timely access to mental health resources by bringing services to students and their families. Campaigns are also frequent in the schools, such as the Natural High campaign, opioid safety, fentanyl prevention, tobacco use prevention, and so on. The Wellness Center services include mental health screenings, assessments, and referrals and prevention early intervention services listed previously, in addition to short-term mental health services, suicide prevention education, dropout prevention, and the Wellness Centers also provide a safe and supportive environment for students. So the Ventura County Office of Education is very, very active in preventing and working with students concerning their mental health and providing a safe place for students to be able to share and be. Thank you. You have a question? Yes.
Yes, my understanding of the funding for the wellness centers was that the young people it's intended that the young people are integral designers of that space and the services. And I was speaking with the, actually, she's a union rep at one of the middle schools. And she was told by the principal that they have a different kind of funding. So the staff's just making something up in a closet in her school. So are there different fundings for the wellness center, or what, can you just clarify that?
Yes, so there are multiple,
know best practice.
yeah, so there are multiple different funding streams. Obviously the ones that we were a part of the initial funding through the MHSSA grant have very specific parameters as per the grant outlines. Subsequent to that, the state has released other funding mechanisms to do so, as well as other the local education areas have decided to use other funds, their own local funds to expand. So yes, the rules are different depending on the funding streams.
Okay, thank you. All right, next on the agenda is the data notebook work group. As mentioned last week, the data notebook is a document that Chair Emeritus Rodriguez explained to us in detail. And they have a theme each year. And this theme, the theme this year is stakeholder involvement. And so Liz Warren stepped up to chair the data notebook work group, and Chair Emeritus Rodriguez has volunteered to also be involved. And I believe there may be another person that will be working on the data notebook.
And if I might add, we would welcome other folks' participation on this effort, because it is, on one hand, is, I know Claudia has mentioned before, is that it's the results of the data notebook are enlightening and informative, and so as well as the process as far as reaching out with subject matter experts on these various issues.
Thank you, Michael. I also wanted to mention that it is a great deal of work to do the data notebook. And so we appreciate the efforts of our BHAB members who stepped up, and also the department, because it is the department that supplies us with a lot of the data and information that we seek. So did you have a question, Elizabeth?
I had a comment because one year I did the entire thing myself, and then that's how I learned about the planning council. And so I'm driving up tonight to the planning council meeting, this quarterly meeting up in South San Francisco, and the data committee's meeting tomorrow afternoon to discuss the future of the data notebook. Because previously, for the past several years, the first half is the same question, so they can track a trend, and the second half is a theme. So if anybody has any ideas or any suggestions or things that they'd like me to bring up to the data committee tomorrow about what they'd like the data notebook to look like and do or see or look at, please share that with me. Thank you.
Great, thank you. All right, next we have board member comments and announcements. So do any of the board members have any comments or announcements? Yes, go ahead, Nancy.
I have several comments and questions. So I don't know quite where to start, but and I know I'm not supposed to take too much time, so I will be careful. I'm wondering, I was reading a lot of things about CalAIM and some of the new things that are coming on. It's very complicated, and I'm wondering, you know, I said updated spending percentages, and then I might wonder, well, what are those other care services? What are the additional priorities? And that was the question I thought. Priorities for money. I mean, it was priorities for spending in addition to what we have done, and then maybe we're going to stop doing one thing and do another thing. And how would you decide what are the priorities that we're gonna look at? I'm sure there must be guidelines that you have to follow through CalAIM. And I'm certainly no expert at all on CalAIM, none of us are, and maybe you're not either, but you're gonna be.
Yeah, so it's actually, you're referring to the MHSA reform. That's what's happening.
Yes.
Yes, which was signed, this past Friday. And will go to the voters in March as Proposition 1. So Janice and I discussed, since the executive committee meeting, that I will come to do a presentation in December at the general meeting to give an overview of what's all happening. Yes.
So I'm just thinking, oh my gosh, I'm overwhelmed by just trying to read this. In the meantime, my other concern is we had someone from the department come and speak to us about how overwhelmed the staff was feeling in trying to get all the changes together that already had to happen. And I'm wondering if that staff satisfaction is, or frustration, I don't know about satisfaction, maybe even just less frustration. I just was really saddened to hear them being so overwhelmed, and I know that there are too few people to do too many things from the get-go. And so we don't want to lose anybody that we've got. They seem very dedicated anyway, but I wondered if you could address that a little bit.
Sure, I would say we're all overwhelmed. We're no different than any other county right now in the state of California. I speak to my colleagues across the state, and we're all facing the same staffing shortages for our clinical services and administration. Unfortunately, we don't have a choice. These are mandates. So we all have to do the same thing and figure out how to make it work. That's why we created, we've done some restructuring in the department to help streamline things. That's why we created the strategy planning and administration under the assistant director's office to help streamline some of the work. We created this strategic initiatives team to help lead some of these efforts and inform our clinical operations divisions and our quality division on how to prioritize and how to best use and maximize staff time. Because again, these are mandates, so we don't have a choice. And we all have to figure out how to make it work while also maintaining that there's only so much staff can do, so.
It's certainly concerning. There was just some curious things that I don't even know what is a CoStar account, COSAR? I don't even know what that is. And I wondered about it was TMS treatment. It's been some kind of eye-related treatment. And they're just things that we don't know about, and I wondered, how do we know or learn about it?
Yeah, so I think you're referring to some of the items that were specifically in the plan. We can go over that.
Okay.
Yeah.
All right, one more little grief, sorry. One of my concerns is the TMIU in the jails. I read something in the paper that somebody they had been in treatment in the TMI unit, and then the unit felt that they were competent to stand trial. And so they went before the judge, and then the judge said, no way, is this person ready to do this? And so he said in the newspaper quote, it was saying, well, immediately send that person to the state hospital, which again, if there was a bed, that would be a real good thing. But my concern is the TMI unit, and then if their clinicians are coming to the conclusion that someone's competent to stand trial, and then their evidence, I guess, is presented to the judge that makes that seem questionable. Are there criteria involved in terms of how, I mean, it's probably subjective, and how to determine if someone's really ready or not ready is tricky. But I wondered if there are guidelines. Michael might know this, I don't know, but certainly if we're supposed to be doing mental health treatment in the jail and it's supposed to be helping people get ready, maybe we're doing the wrong thing, or it needs to be stronger.
I just wanted to comment that one of our board members, Sergeant Pusey, Scott Pusey, who's not here today, is on the TIM unit. So maybe you could email him or CC me, and he can reply, and we can share that with the board, unless Michael does have some information. Okay.
With respect to the competency restoration. The goal in that, as far as that portion within the 10-unit, isn't necessarily to provide behavioral health treatment, but to attempt to restore them to competency so that they can stand trial. And there is a, you know, it is a subjective, the criteria is subjective, but the goal in and of itself isn't as far as competency restoration, that, which is one part of the 10-unit. Is merely to attempt to restore competency so that criminal proceedings can be reinstated. So I can't really get into like as far as like there's no like 1, 2, 3, 4 equals incompetent, or if this element, this criteria isn't met, then it's automatic. A lot of times it is subjective. It's going to depend upon medications, those kinds of things. So there's no, unfortunately, one size fits all determination of whether someone's competent or incompetent to stand trial.
Are there examinations or tests or anything like that? Do you know?
They do undergo, there are certain tests that they undergo. Some of them are merely asking is whether they can memorize who's who in the courtroom, as far as what's the role of the prosecutor, what's the role of the judge, what's a guilty plea, what's a trial, those kinds of things. And then there's other considerations that need to be taken in, that must be evaluated as well. Can they meaningfully assist in their defense? And oftentimes that's the biggest hurdle that they have. Merely memorizing that, that's the defense attorney or that's the judge is a part of it, but they have to have the ability to meaningfully participate in their defense.
Well, anyway, I found that really alarming for another benefit.
Thanks, Nancy. Jennifer?
Hi, Loretta. So one of the issues that Director Gilman was working on was the ombudsman issue that Liz and Ratan both did a lot of work on. And I was wondering if you were gonna pick that back up while he's gone, or if Liz, maybe you have some information, but I would like an update on what we're doing there.
Okay, Loretta, do you mind? Okay, great. Yeah, Loretta and I had a conversation, and for right now it's being tabled because of the various things that she's in the middle of transitioning, and we will be picking it up and we will be revisiting it, absolutely. And if you'd like to rejoin us, we would welcome your participation, because I knew that you had to step away for family reasons.
Thank you.
Thank you.
Yes, thank you, Dr. Jenner.
Okay. Go ahead, Diane.
I just felt terrible because I didn't say what we did at Youth and Family Services. We did have two really great, two presentations on Atlas and Insight. One, it is, serving 15 and maybe up to 18 youth with services. They started in East County in February, moving to, started in West County in February, moved to East County in August. So not a lot of information on that on East County yet, but it's basically, meeting these youth where they are and providing services for them. And they gave us the criteria for what Atlas needed for service. And then we also, through the Juvenile Collaborative Court Program, heard about Insights, which was also participating agencies, our probation, behavioral health, public defender's office, district attorney's office, office of education, public health, juvenile courts, and United Parents. And so the representatives were here, and it was really, it really was two great programs that we're running, and the presentations were really good. So I'm sorry that I forgot about those when it was time to report.
Thank you, Diane. It's very helpful. Thank you. I'm going to be sitting around a piece of paper. If you have a phone and you want to snapshot it, it is brief synopsis of SB 43, SB 326, and AB 531. So if you want to snapshot this so that you can just get a brief overview of what these bills are about and a description, please feel free. Next on the agenda, sorry. Oh, Elizabeth, sorry, I didn't see your hair.
Okay, thank you. I'd like to make 3 announcements, please. First, the TA committee, because I'm gonna be up in South Side, in the Bay Area this week, the TA committee's been rescheduled to next Wednesday. Thank you, Jackie, for doing all the work around that. At 3:30. Typically in that committee, I invite and people that are on the committee participate. We get a report from someone from the COC. Jen's gonna be on vacation, but Alicia's gonna be doing the report on housing, specifically around THU. And also Carol from the Homeless Services, DCOE, the Cherry County Office of Education Homeless Services, will be also giving some information about youth that are unhoused. So it's a kind of a good opportunity. We share some information. So that's next Wednesday, not this Wednesday, the following Wednesday in this room at 3:30. Second, because of my some of the work that I've been doing for several years with CAMPRO, which is the California Association of Mental Health Peer-Run Organizations. CAMPRO is currently, and that's a statewide organization, one of the contract holders for the stakeholder groups of people who have lived experience of using services with the MHS OAC. They're doing a 5-5 event where in 5 weeks they're visiting 5 regions across the state. They'll be here visiting the program that I'm running and just getting sent to Ventura. And that's on next Monday, the 23rd. So they are coming to the space where my program is, and then at 2 o'clock doing just kind of person on the street interviews, like what do you know about peer stuff, what do you see some of the things, and we're going to be down by the pier, so it's peers by the pier on Monday at 2 p.m. and if your people are interested, please contact me and I'll give you some more information about that. They're going to be doing some live streaming, and then after they're finished their tour of the state, they're going to be making like a documentary to be posted on YouTube, on their YouTube channel. And the final thing that I just like to share is if I attend that Veterans Collaborative meeting every month. So Monday, November 6th, this is kind of an event that's happening all across the nation. Operation Greenlight to just light Ventura County Veterans Memorial green and support military veterans. That's November 6th at 5:15. They've done some updates in that memorial over there, and it's going to join a nationwide effort. So thank you.
Thank you very much.
Yes, no, go ahead.
Thank you. October 27th, 6:15 to 9 p.m. Spirit of San Paulo will be having our very first gala. And that would be, we would have previous guest speakers, auction and catering from Flight 126. Also at this event, Kay will be introducing the new director for Spirit of Santa Paula. We have about 110 tickets left over. They are going for $100. So I can send out that information. Thank you.
Thanks, Kelly. Yes, please do send out the information, get it out to the board and the public. So thank you. Okay, next we have secretary's announcements.
Thank you, Chair. Briefly, well, I wanted to say our chair is going to be doing the announcements now, so my secretary's report will be brief. So as of today, District 2, Jeff Burrell's office still has an opening. I know that he is open to suggestions, so if you can think of anyone, let Janice Gardner, our chair, know, or myself, and we can pass along that information. And Soledad Barragan was reappointed by the Board of Supervisors, and she'll be in for the next term.
Thank you, Jennifer. Next, we have site visit resumption. Is there any news for any of the site visits that we have members wanting to meet?
No, right now there isn't an update, and we're going to table it to next month. That would be sure.
Okay, Jackie, would you mind putting that on next month, please? Thank you. And then we have then next we have the annual report update. Chair Emeritus Rodriguez, do you have anything?
Not at this point. We're waiting for reports from 2 committees. Thank you.
All right, the next agenda item is the announcement to open the public comment period on the Mental Health Services Act 3-year plan adjustment. So we are opening the public comment period on the Mental Health Services Act 3-year plan adjustment. And it will be open until, let's see, I don't know what the closing date is. Is Hillary still here?
November 20th.
Yes, so Hillary, would you mind stepping up to the mic and just explaining just a little bit about it so that our BHAB members and the public can know where they should respond or send comments during this 30-day period, please?
Sure. So bcbh.org, the mid-year adjustment is posted. It's the same plan that's already been up that was finalized in June. We got a one-time adjustment of just over $30 million. That's why we had the very recent CPP meetings that took place. We have now reposted the plan, which includes the $30 million and how we'd like to allocate them. It will take everybody to get those projects up and running and get that money allocated and used. We're on a kind of a ticking clock. So please, if you haven't looked at those plans before, I highly recommend you do today. We've printed some extra copies up there if you'd like to grab one if you're a paper person. We'll take comments through November 20th. That's when we'll have the public hearing, which is the last point in time to make adjustments to this 3-year plan. But we'll be back in about 2 months or 3 months after that for the annual update where we'll do this process again. So it's kind of a living document that will be consistently changing and updating as projects become either more realistic or less realistic based on the tight timeline that we have. So now it's open, it's posted, and we look forward to hearing from you. MHSA@mentora.org for any emails. Or you can call us, or you can email anybody that you normally reach out to and let them know that you want some information to come to us. So really any line of communication is open for this because we're kind of desperate to get this money out to the community appropriately.
Thank you, Ms. Carson. Elizabeth?
Yes, well, since you're here and we're here, could you just tell us what you're proposing with the money? And it sounded like what I thought I heard you just say that you had some ideas already, and you're just kind of looking for confirmation.
There's a whole list of ideas in that plan. I think the primary ones have already been kind of stated. We're seeking approval from the state for building an MHRC. That's not something that's typically allowed with MHSA funding, but we feel like we have been able to make the case under the current regulations. So that's one of the biggest ones. The board and care for our elderly population is another one that we're looking to do. We have a couple other housing projects in the works. For CSS, the other major priority is FSP services. We're looking to expand that kind of across the board, adding some additional housing and housing vouchers for those all age groups as well. What else? For PEI, we're looking to expand what we have, including early intervention services for time limited, mild to moderate across the area, including the Santa Clara Valley. We're looking to establish a new Oxnard Youth Drop-In Center. That's something that has been kind of on the back burner for a while. You know, we don't have providers for all of these services outlined necessarily, so that's why we're hoping that people will read the document, share the document, and let us know what you think. And trying to think, our mental health awareness through the arts is another one that's on there. Really kind of everything that exists, we're looking to expand in a way that hopefully folks can manage, because this you can't just add staff unless you've got a grant coming down the pipeline in 2 years. So we want to be really mindful that we're not setting people up to fail, especially our smaller organizations. So we're also hoping to transition some of our PEI providers into potentially being able to bill Medi-Cal so that we can transition them under the Prop 1 adjustment and keep them providing services in the community. We're doing some administration infrastructure work. I mean, the list is really long and I understand there's not a lot of detail. So if you want to reach out to us, you can do that as well. And we can explain it.
The places where we have more detail, we try to include that, but again, there are certain areas where we're proposing it because we think it's important. And it fits within the MHSA guidelines and our last needs assessment. It doesn't mean that we have somebody that's ready to go to do it. So those are the ones that we may have to come back in a couple months and say, we're gonna adjust.
Thank you, Hillary. Yes, I just wanted to mention that the hard copies of the community planning process. And to answer your questions, Elizabeth, I know that you're out of town, but it's in the agenda packet. So and it's right here. So
that is not in there.
I'm sorry.
Another packet, this is if you want to participate.
Yes.
This is in the
Okay, thank you. All right.
Can I just, first, thank you, Hillary. I'm just really struck how everybody's concerned about the shift with 326. And exactly the things that you're proposing to spend the money on is exactly how the state wants to change the money. So it's just kind of very striking to me listening to that.
We still have to spend the current dollars exactly how the law exists now. So it puts us in a little bit of a conundrum in that way. So we're hoping that we can make that clear to people that are willing to take that funding and tell them, you know, here's the money and please start looking for other funding as well. So it's a challenge for sure.
Thank you, Hillary. Yeah, the best way it was summed up to us in a state call last week was old money, old rules.
Thank you, Dr. Dennery. Okay, great. All right, so if everyone would like to, grab it, it's in the packet, but there's another. If you want to participate, the whole packet is right here. And thank you, Jackie, for making all of these copies. It's a lot of work. We really appreciate your efforts. Thank you. Did you? Oh, go ahead.
I just wanted to thank Hillary for putting this together. It was really well done and helps us to get kind of a snapshot, and then we can go to the online to read those fine details of what these pages suggest. So, it helps us a lot. So thank you for doing that.
Okay. Did you have a question?
I just want to make a quick statement. One of the things that Dr. Shipper and Hillary that we talked about when we were doing the stakeholder process is that it's very important because this is a one-time infusion of this kind of money, is that whatever we do has to be sustainable. And so even though, so grants coming down the pipeline, things like that, and there were many community-based services that were discussed, but the important thing is that whatever happens, it has to be sustainable. So because we won't be getting another $30 million.
Thank you, everyone, for your comments. All right. Next is presentation requests. And November, I wanted to mention that we have a veteran, Lieutenant Carlos Garcia, will be presenting. We're very excited to have him speak to us in November, and we will be sending out more details and his PowerPoint presentation with the November announcement. So we appreciate that, and I thank you to James for making these arrangements for us. Did you have a presentation request? I do. Okay, please.
Thank you, Chair. I think I brought this up a couple months ago. We had a presentation from the Stepping Up program, and it was brought up that it was the exact same program. It was the same presentation from the year before, and our nonprofit actually met with the sheriff a couple days later, and he gave us a really great update on the Stepping Up program. So I don't know if we can get in touch with Sheriff Matthews.
He's actually.
I'm sorry. I'm sorry. The assistant sheriff. But anyways, he did a great job of giving us some really good updates. And I was wondering how we can get him to come. He offered to come present at the BHAB. So would that be you reach out, or don't you reach out?
Yeah, it would probably, yeah, you could go ahead and send through the request. We do have the department in December. Dr. Dennering is going to go over CalAIM and MHSA and all the new rules, or as much as you can do, and then a presentation to the BHAB. But so December is already booked, and so is November. So we could certainly talk to, I think it's Sergeant Matthews. I don't know, maybe it's higher than that. Assistant Sheriff, yeah, I thought it was Assistant Sheriff, thank you. And see maybe if we can possibly book him for January, because that would be fantastic to have them come back to us now that the program is up and running. Good idea, thank you. James?
Can I just add to the for next month's presentation, if you have any specific questions you'd like answered, maybe route them to Janice. And if we can try to front load those, that'd be helpful because of the time limited. And then, like I said, I'll provide the additional information from Carlos later.
Okay, and James, what did you tell me his presentation, you don't have the exact title, but what did you tell me that his presentation is going to be focused on, please?
It's a veteran cultural competency.
That's very helpful when we ask for questions. Great. Okay, thank you so much, James. Appreciate that. Yeah, okay, sorry. Okay, recognition award recommendations. If anyone has a recognition award recommendation that they would like the BHAB to consider, please send your recommendations to myself and CC Jacket. And next are contract reviews, public comments. Also, if you have any public comments, this is a good time to speak. Is there anyone online or in the audience? Public comment. Okay, please go ahead to the mic. Thank you.
So just for clarification, public contract, now you need to take the line. Great.
And then after that, we'll do the contract review.
I'm Jen Rodriguez of Turning Point Foundation's Growing Works. As you may or may not know, we are a mental health recovery program and a wholesale nursery located on South Lewis Road in Camarillo. We are celebrating 5 years of our program this year on October 28th. So this is my invitation to come join us. We'll have a plant sale, a band, that various artisanal vendors, a taco truck. It's a great time. It's from 10 a.m. to 2 p.m. on October 28th. So I'll have flyers just because they're fun. I brought along a succulent pumpkin. We've been having public succulent pumpkin workshops. There's the visual.
Very nice.
Starting the Saturday after Thanksgiving, we'll also have succulent tree and wreath workshops. Those are open to the public. We've worked hard under the confines of HIPAA law. So we want to build a community and build awareness of Growing Works while also protecting the privacy of our members and supporting employees. So sometimes that's a delicate balance, but I believe that Growing Works is good for the community, and the more community awareness and support we have, the better. We recently got magnets for our delivery trucks that say Growing Works Cultivating Mental Health, which is our slogan, and it has our website. And our members were so excited about those. We've been so purposeful not to out our people and violate HIPAA law, but there is a growing pride in being a member or a supported employee at Growing Works. Member is what we call our clients because they are members of the community. And we're really proud to be selling to people like the Huntington. We have a multiple $1,000 order that will be delivered to the Huntington this month. And a number of other prominent horticultural organizations through the greater Los Angeles area and all the way up to Sylvan. So please come grab a flyer in the back. We'd love to see you on the 28th, and thank you for supporting Growing Works.
Thank you. Thank you. Would you mind giving us your address so if anyone would like to go and buy some pumpkin succulents or Christmas or holiday fair? Would you think?
Absolutely. We're at 1736 South Lewis Road. It's also on the flyer. Please note, we're not open to the public Monday through Friday. We only have retail sales twice a month on the 2nd and 4th Saturday. The 28th is the 4th Saturday from 10 a.m. to 2 p.m. It's all online at growingworks.org. So plenty of information is also available on our website, Instagram, or Facebook.
Thank you so much. Okay. Next, we have contract review, the Board of Supervisors agreements, plural, September 12th, 2023.
there are any comments, please raise your hand. Fiscal year 2023-27, approval and ratification of BHBH programs programs grant funding. Fiscal year 2023-24, City of Simi Valley agreement to provide mental health outreach and engagement services. Fiscal year 23-24, submit staffing LLC agreement for temporary staff and recruiting services. And then on the 28th of September, Board of Supervisors agreement, fiscal year 23-26, intergovernmental transfer agreements for the California Department of Healthcare Services. So are there any comments about these contracts from anyone? Okay.
Yeah.
Oh, yes, Elizabeth.
I know this is across the county, there's significant amount of staff that are temporary, that are under these temporary agencies. Can you give us this kind of kills me. Can you give us a sense of what percentage of staff here, or is there any kind of breakdown, or in departments particularly that has a temporary staff in it?
I can't give you a specific breakdown at this point. Temp staff are used just as needed to backfill vacancies or for folks who are on long-term absences. And it really just depends. We also use it as a mechanism to get staff in quicker, so they can come in through the temp agency as they go through the county recruitment process and then eventually be in the county position.
Do you know approximately how many people are out on long-term leave? Just because you can't actually fill those, or even.
It depends. I can't give you that, but I can get back to you with that.
That's great, thank you.
Okay, are there any public comments from anyone online or in the room? Okay, so we have 10 minutes remaining for our Behavioral Health Advisory Board meeting. And so I would like to know if there are any further questions for Valcor or staff, or any comments that you might have. And I appreciate all of you staying. It's very helpful. Thank you.
I just wonder, in the Valcor presentations and the information, there are several places where there's community advocacy. I'm wondering what does that really mean?
Alex, do you want to answer that, or Dr. Donovan, or?
Sure, yeah. So we would be able to look at the other category that we had. There were many people who would select something, let's say community advocacy, and would maybe put something more specific in the other category. And so that's definitely something that we would be able to cross-reference and check to see if that got filled in.
Is that all? Yeah, did you have any further comments? No. Okay, thank you. All right, well, if there are no further comments or questions for Valcor, I'm going to adjourn the meeting. So the meeting is adjourned. Thank you, everyone.
Thank you, Janice.
Thank you.